The first person everyone laughed at that morning was the only one who never laughed back. When the faded tattoo slipped out from beneath the cuff of her scrub sleeve, one of the younger doctors glanced at it and smirked. "Looks like somebody forgot to remove their college mistake," he joked. A few people nearby chuckled without looking up from their charts. Another physician leaned against the nurse's station. "I've seen cleaner tattoos on old sailors." The comments weren't loud, but they were loud enough. A lot of us heard every word. She simply adjusted the sleeve of her scrub top, covering the worn ink again, and continued checking medication orders as if nothing had happened. Her expression never changed. One of the veteran nurses quietly looked at her. "You okay?" Elara offered a small smile. "I'm fine." It was the same answer she always gave. The morning inside the trauma center moved at its usual fast pace. Phones rang. Stretchers rolled through the automatic doors. Familias waited anxiously in crowded hallways. Monitors beeped from every direction. The hospital never really slowed down. Neither did Elara. She moved from room to room with calm confidence, speaking gently to frightened patients and reassuring worried relatives. She never rushed her words, even when everyone else seemed to be running. People trusted her without knowing exactly why. A frightened little boy stopped crying the moment she knelt beside his bed. An elderly patient squeezed her hand before being taken for scans. Even patients she had only met minutes earlier somehow felt safer after talking with her. Still, some of the doctors barely noticed. To them, she was simply another experienced trauma nurse. Nothing more. Near noon, the emergency department received notice of a multi-vehicle highway accident. Within minutes, ambulances began arriving one after another. Every available nurse and physician hurried into action. Elara was assigned to help care for a middle-aged construction worker who had suffered serious injuries during the crash. The attending physician quickly examined him. "Blood pressure is holding," he said. "Let's prepare him for imaging." As everyone started moving, Elara paused. She noticed something almost invisible. The patient's fingers were becoming unusually pale on one side. His breathing had changed ever so slightly. She leaned closer, studying his face. Something didn't feel right. "Doctor," she said calmly, "could we check him again before sending him?" The physician barely looked at her. "We've already assessed him." "I understand," Elara replied. "But I think something's changing." The doctor sighed. "What exactly do you think you're seeing?" She pointed carefully. "His breathing pattern. His color. It doesn't match what we saw 5 minutes ago." The physician looked again, mostly to prove her wrong. Then his expression changed. "Hold on." He repeated the examination. Within seconds he called for additional tests. The room suddenly became much busier. One of the residents looked surprised. "You were right. A hidden internal injury had begun causing dangerous complications much sooner than anyone expected. Because it was caught early, the patient was rushed directly into surgery before the condition became much worse." As the team left the room, another nurse quietly whispered to Elara. "Nice catch." Elara simply nodded. It was everyone's work. She never mentioned that she had been the only one who noticed. Later that afternoon, the attending physician accepted praise from another department for the quick diagnosis. Elara stood nearby organizing supplies. No one mentioned her name. She didn't seem disappointed. She simply continued preparing the next treatment room. One of the housekeeping staff smiled at her. "You always stay busy." She smiled back. "There's always someone who needs help." Hours passed. The emergency department settled into a rare quiet moment. Doctors gathered around the coffee machine, talking about weekend plans. Someone noticed the edge of Elara's tattoo again while she reached for a patient file. "There it is," one doctor laughed. "The famous mystery tattoo." Another shook his head. It looks military. No chance, someone replied. If she'd actually served, we'd know about it. Maybe she watched too many action movies. More laughter. When senior surgeon finally joined the conversation, he folded his arms and glanced toward Elara. So tell us. She looked up politely. Tell you what? That tattoo. It's personal. Were you really in the military? For a brief second, the room became quiet. Everyone waited. Elara considered the question. I've had a different life before this hospital. The surgeon smiled. That doesn't answer it. She simply returned to her paperwork. I prefer to focus on today's patients. Someone muttered under his breath. Convenient answer. The conversation drifted away, but several people exchanged amused looks. Only one older nurse watched Elara closely. She noticed something almost nobody else did. When the question stopped, Elara quietly rubbed the edge of her covered wrist for just a second before letting her hand fall naturally back to her side. It was such a small movement that most people never would have seen it. Outside, gray clouds slowly gathered over the city. Inside, another emergency alert suddenly sounded across the department. Every phone at the nurses' station chimed at once. The charge nurse answered first. Her expression changed immediately. What? She listened carefully. Understood. She hung up and looked around. I need every trauma room prepared immediately. The room instantly came alive. What happened? Someone asked. We're receiving a high-priority military patient. Several doctors looked at each other. Military? From where? No details. Hospital administrators hurried into the emergency department carrying radios. Security officers appeared at every entrance. The atmosphere changed within minutes. Even experienced staff sensed something unusual was happening. Then came a sound that silenced every conversation. Tum. 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 At first it was distant. Then louder. The unmistakable rhythm echoed through the hospital walls. People slowly turned toward the windows. One resident stepped closer. Is that? The sound grew stronger. Doctors, nurses, patients, and visitors all looked outside together. A Black Hawk helicopter descended toward the hospital landing zone. Before anyone could speak, a second Black Hawk appeared behind it. Nobody inside understood why two military helicopters had just landed outside their hospital. And no one realized who they had come for. Nobody moved for several seconds as the helicopter blade slowed outside the hospital. The deep thumping sound echoed through the emergency department, leaving doctors, nurses, patients, and visitors staring through the windows in silence. One of the younger residents finally spoke. Why would they send two Black Hawks here? No one answered. The charge nurse quickly pulled everyone's attention back. Let's stay focused. Trauma rooms are ready. Keep the hallway clear. Outside, uniformed military personnel stepped onto the landing pad with calm precision. They weren't rushing or shouting. They moved with purpose, speaking quietly into radios while securing the area around the helicopters. Hospital security officers opened the emergency entrance. The hospital director hurried downstairs with two senior administrators beside him. The chief surgeon followed, straightening his white coat as he walked. This must be a VIP transfer, one administrator whispered. It has to be, another replied. Inside the trauma department, Elara Vaz continued preparing equipment. She checked oxygen connections. Verified medication trays. Made sure fresh force supplies were ready. She worked exactly the same way she had worked every other day. One of the veteran nurses looked at her. You don't seem nervous. Elara smiled gently. Worry doesn't help patients. Before anyone could say another word, the entrance doors opened. 6 military personnel entered first. Behind them came a gray-haired officer wearing the insignia of a senior commander. The conversation stopped immediately. The hospital director stepped forward with a welcoming smile. "I'm Director Holden. Welcome to." The officer shook his hand politely but briefly. "Thank you," he says, continued scanning the room. The chief surgeon stepped beside the director. "I'm Chief Surgeon Rowan. My trauma team is standing by." Again, the officer nodded. But he still appeared to be searching for someone. The room became strangely quiet. Finally, he spoke. "I'm looking for Nurse Larabas." The words landed harder than anyone expected. The director blinked. "I'm sorry, who?" "Nurse Larabas." The chief surgeon looked confused. "Our trauma nurse?" "Yes." Several doctors exchanged puzzled looks. The younger physician who had joked about her tattoo earlier frowned. Why would they need her? The officer remained calm. "Please bring her here." The charge nurse turned toward the treatment area. "Lara." She stepped into the hallway, removing a pair of gloves as she walked. "You were looking for me?" The officer's serious expression softened the moment he saw her. "It's been a long time." For the first time that day, a faint look of surprise crossed Elara's face. "It has." The officer extended his hand. Instead of shaking it, Elara gave a respectful nod. "It's good to see you're doing well." "And you?" Several members of the flight crew smiled quietly. One younger medic whispered to another. "I told you she'd recognize him." The entire emergency department watched without understanding. The hospital director cleared his throat. "May I ask, how do you all know each other?" The officer answered simply. "We served together." Silence filled the room again. The chief surgeon looked directly at Elara. "You were actually in the military?" She met his eyes calmly. "I was." "For how long?" "A while." It wasn't an answer that satisfied anyone. The officer glanced toward the hallway. "We have a patient arriving in less than 2 minutes." The trauma bay immediately became active again. Stretchers were positioned. Equipment was checked one final time. Doctors took their places. The military medical team wheeled in a patient surrounded by monitors and carefully organized equipment. His face showed exhaustion more than injury. Even before reaching the trauma room, he seemed to be searching the faces around him. The chief surgeon stepped forward. "I'm Dr. Rowan." We began evaluating him immediately. The patient slowly turned his head. His voice was weak but steady. "Where's Elara?" Every person in the room froze. The surgeon leaned closer. "I'm leading your care." The patient barely looked at him. "I asked for Elara." The officer gently placed a hand on the patient's shoulder. "She's here." Elara stepped beside the bed. The man's tired expression changed almost instantly. "There you are." She gave a small smile. "I made it. I knew you would." One of the military medics quietly looked away, giving the two of them a moment. The chief surgeon tried to continue. "We need to begin our assessment." The patient nodded once. "But she stays." The surgeon hesitated. "Of course she'll assist." The patient slowly shook his head. "No." His breathing remained steady, but his voice carried complete certainty. "I trust her." The room became uncomfortable. The director looked toward the officer. The officer answered before anyone asked. "He's very clear about that." The chief surgeon lowered his voice. "I'm the attending physician." "No one is questioning your authority," the officer replied respectfully. "But if Nursevas believes something needs attention, I strongly recommend listening." Several doctors looked surprised. The recommendation carried unusual weight. Elara herself seemed almost embarrassed by the attention. She quietly adjusted one of the patient's blankets. "You're safe now." The patient managed a tired smile. "You always say that." She looked at him. "Because it's true." The officer noticed several confused faces around the room. He understood what everyone was wondering. "You've all worked with Nur Sebas for years." No one answered. He continued. "But I don't think any of you know who she used to be." One resident spoke carefully. "We know she's an excellent nurse." The officer smiled faintly. "She's much more than that." The younger doctor who had mocked her tattoo earlier shifted uncomfortably. "You mean, she was a medic?" The officer looked directly at him. "One of the finest combat trauma specialists I've ever worked beside." The room fell completely silent. Nobody laughed now. The chief surgeon slowly looked toward the faded tattoo barely visible beneath Elara's sleeve. Everything he had assumed suddenly felt uncertain. Elara noticed everyone's eyes on her. She quietly spoke before the silence became awkward. "Right now, none of that matters." She looked around the room. "Our patient comes first." Those simple words brought everyone back to work. Doctors resumed preparing medications. Nurses checked monitors. The trauma room settled into its familiar rhythm. Yet nothing felt quite the same anymore. People who had worked beside Elara every day suddenly realized they knew almost nothing about her life before this hospital. As the medical team continued its evaluation, the patient reached weakly toward Elara. She leaned closer. He whispered something only she could hear. Her expression changed for the first time. Not fear. Not surprise. Recognition. She looked toward the senior officer. He gave one slow nod. Whatever the patient had said clearly meant something important. The officer quietly dismissed the rest of the military personnel from the room, leaving only the essential medical staff behind. The doctors exchanged uncertain glances. Something much bigger than an ordinary military transfer had just arrived. And for the first time, everyone in the hospital began to wonder what secret Elara Vaz had been carrying all these years. The quiet nurse everyone thought they knew suddenly felt like a complete stranger. As the trauma team worked around the patient, the room stayed focused, but curious eyes kept drifting toward Elara Vaz. She ignored the attention and concentrated on the monitor above the bed. "Blood pressure is stable for now," one nurse reported. Chief Surgeon Rowan nodded. "Let's continue the assessment." The patient, a decorated Special Operations Commander named Calder Reese, kept his gaze on Elara whenever he opened his eyes. He looked calmer when she stood nearby, as if her presence alone helped him breathe easier. "You've been through worse," Elara said softly. A faint smile crossed Calder's face. "I remember you saying that before." The words caught the attention of everyone in the room. Chief Rowan glanced at her. "You've treated him before?" Elara hesitated only a moment. "Years ago." "Where?" She looked back at the patient while adjusting in four-line. "Far from here." It wasn't meant to avoid the question. It was simply all she wished to say. The senior military officer stepped closer. "There will be time for stories later." Rowan accepted the answer for the moment. The team continued working, and within minutes the patient's condition appeared steady enough to move for additional imaging. Just before they prepared to leave, Elara noticed something small. Calder's fingers tightened briefly against the blanket. His breathing became just a little shallower. Most people would have missed it. She didn't. "Let's wait." The chief surgeon looked up. "Why?" "I'd like another full assessment before transport." Rowan checked the monitor. "His numbers are acceptable." "I know. So why delay?" Elara looked at Calder instead of the monitor. "Because he doesn't look comfortable." One of the younger doctors quietly sighed. Vitals don't support that. The senior officer remained silent. He simply watched Elara. She leaned closer to Calder. Can you tell me where it hurts? He answered slowly. Not where you'd expect. What changed? He took another careful breath. It feels familiar. Only Elara seemed to understand what he meant. She turned back toward Rowan. I think we should repeat the scan. The surgeon folded his arms. We just completed an evaluation. She nodded respectfully. I understand. But I'd still repeat it. For several long seconds no one spoke. Finally, Rowan looked toward the officer. The officer answered calmly. If Nursebas has a concern, I'd listen. The surgeon took a slow breath. Fine. One more scan. Nobody argued after that. As preparations continued, the older military officer stepped into the hallway with one of the hospital administrators. Several staff members quietly followed, pretending to organize paperwork while hoping to hear more. The administrator finally asked the question everyone wanted answered. What exactly did Nursebas do in the military? The officer looked through the glass window toward Elara before speaking. She served as a combat trauma specialist attached to rescue operations. The administrator blinked. I've never heard of that unit. You weren't supposed to. Another pause followed. Was she deployed often? The officer gave a small nod. Enough. What made her leave? His expression grew quieter. She believed she'd carried enough memories for one lifetime. Back inside the trauma room, one of the veteran nurses gently approached Elara while organizing supplies. You never told us. There wasn't much to tell. I think there was. Elara smiled faintly. It was another chapter. The nurse glanced toward the faded tattoo on her wrist. I always wondered about that. Elara looked down at it for a moment. The ink had softened over the years. Its sharp lines had faded into gentle shades of gray. It reminds me not to forget. What does it mean? Elara remained silent for several seconds. It belonged to a rescue team. Were they your friends? She nodded once. The best. The nurse sensed there was more behind those words but chose not to ask. Sometimes respect meant leaving painful memories untouched. A few minutes later the repeat imaging began. Everyone watched the screens carefully. The room stayed unusually quiet. Then the radiologist looked closer. Hold on. He adjusted the image. I need another angle. Chief Rowan stepped beside him. What is it? There. He pointed toward a small area that had looked normal earlier. The surgeon's expression immediately changed. I didn't see that before. Neither had anyone else. The hidden complication had become visible only because Elara insisted on looking again. The younger doctor who had laughed at her tattoo slowly lowered his eyes. If we'd moved him. He didn't finish the sentence. There was no need. Everyone understood. Rowan turned toward Elara. You caught it. She simply answered, the scan caught it. He shook his head. No. You did. For the first time since they had met, there was genuine respect in his voice. As the team quickly adjusted the treatment plan, Calder quietly watched the exchange. He smiled weakly. I told you. Rowan looked at him. Told us what? Calder answered with visible effort. When she says, stop. He paused for breath. You stop. Several military medics exchanged knowing smiles. Clearly, they had seen this before. The senior officer walked back into the room. The helicopter crews are waiting. Rowan looked surprised. They're still outside? They said they aren't leaving without him. He looked toward Elara. And they aren't leaving without thanking her. She immediately shook her head. They don't need to do that. The officer smiled. They've been trying to thank you for years. Before she could answer, an alarm sounded from the monitor. Everyone turned at once. One number had changed. Ten anote. The room instantly shifted back into emergency mode. Nurse. I see it. Pressure's dropping. Rowan stepped beside the bed. What's happening? Elara looked at Calder's face, then at the monitor, then back again. Her expression became completely focused. The hidden complication they had just discovered was changing faster than expected. The operation they hoped could wait no longer could not be delayed another minute. As the surgical team rushed to prepare the operating room, Calder reached for Elara's hand one last time. His grip was weak but steady. You stayed. She gave a reassuring nod. I said I would. He closed his eyes briefly. I knew you wouldn't leave. The operating room doors opened. The team began moving him toward surgery. No one in the hospital questioned Elara's place beside the stretcher anymore. But as the doors closed behind them, every doctor suddenly realized the quiet nurse they had underestimated might be the one person standing between their patient and disaster. The moment the operating room doors closed, every second began to matter. The surgical team moved with practiced speed. Bright lights filled the room as equipment hummed quietly in the background. Chief Surgeon Rowan stood at the operating table, giving calm instructions while nurses prepared the instruments. Elara remained beside the anesthesia station, watching every monitor instead of the people around her. Years had passed since she had worked under military pressure, but the habits had never left her. She noticed everything. The smallest change in breathing. A slight shift in skin color. The rhythm of every heartbeat displayed on the screen. Rowan glanced toward her. If you see anything, speak up. She gave a short nod. I will. No one questioned her role anymore. Outside the operating room, the waiting area had become unusually quiet. The senior military officer stood beside the hospital director, watching through the observation window. The director finally spoke. I've worked with Elara for almost 6 years. The officer looked at him. And yet today feels like you've just met her. The director slowly nodded. I thought I knew everyone on my staff. You knew the nurse. It paused. You didn't know the person. Back inside, the operation continued steadily. For a while, everything seemed under control. Then Elara noticed a small change on one of the monitors. Her eyes narrowed. She looked from the screen to Calder's face and back again. Something wasn't right. She stepped closer. Doctor. Rowan looked up without taking his eyes from the procedure. Yes. I'd like you to check the lower field again. He glanced toward the area she indicated. It looks clear. I know. But something doesn't match. One of the assisting surgeons quietly whispered, the numbers still look acceptable. Elara answered without raising her voice. They're changing too smoothly. The surgeon frowned. What does that mean? It means I don't trust them yet. Rowan paused for only a second. Everyone in the room waited for his decision. Then he spoke. Let's inspect it again. No one complained. The room stayed silent as he examined the area more carefully. Several long seconds passed. Then he stopped moving. There it is. The hidden source of the problem had been almost impossible to notice. Had they continued without finding it, Calder's recovery could have become much more difficult. Rowan looked toward Elara. You saw it before the monitor did. She quietly replied, the patient was telling us. The younger surgeon looked confused. He wasn't even speaking. He didn't have to. Nobody laughed. Nobody questioned her. The respect in the room had become genuine. Outside, one of the helicopter crew members sat quietly with another medic. "You think she'll recognize everyone?" The medic smiled. "She always remembered names." "Even after all these years?" "Especially after all these years." The older crew member looked toward the hospital. "She never forgot anyone she brought home." His words stayed with the group. Inside the hospital records office, an administrator searched through archived personnel files after receiving permission from the director. Most of Elara's employment history looked ordinary. Then one attached document caught his attention. It wasn't detailed. It simply listed several military commendations and letters of appreciation. Many sections had been officially withheld. The administrator quietly handed the file to the director. He looked through the pages in disbelief. There was no mention of this during hiring. The human resources manager answered softly. "She never used any of it." "Why not?" "Because she asked us not to." The director looked back toward the operating room. For the first time, he understood why she had never corrected anyone who underestimated her. She hadn't wanted recognition. She had wanted peace. Inside the surgery, the atmosphere remained focused. Calder's condition slowly improved. Then, without warning, his heart rhythm changed. A warning tone echoed through the room. Every member of the team reacted instantly. Rowan remained calm. "Stay with me." The anesthesiologist adjusted medications. Another nurse updated the monitors. Elara watched the screen carefully. She didn't panic. She remembered another operating room years earlier. Different country. Different uniforms. Same sound. The memory lasted only a heartbeat before she returned to the present. She leaned toward Rowan. "Let's slow down." He looked surprised. "We're losing time." "I know. But rushing now will cost more." He searched her face. There was no fear. Only certainty. He trusted her. "Slow the next step," he instructed the team. The room adjusted immediately. The change seemed almost invisible. Within moments, Calder's heart rhythm became more stable. One nurse quietly exhaled. She hadn't realized she'd been holding her breath. Rowan glanced toward Elara. "You've done this before." She answered honestly. "Too many times." No one asked where. No one needed to. Calder's eyelids fluttered briefly. Though still heavily medicated, he managed to whisper only a few words. They laughed. Elara leaned closer. "Don't talk." A faint smile appeared on his face. "They always laugh first." She gently squeezed his hand. "Save your strength." He opened his eyes just enough to look toward Rowan. "You'll learn." His voice faded. "Listen to her." Rowan lowered his head slightly. "I already have." Those simple words carried more weight than any apology. Hours earlier, he had doubted her judgment. Now he welcomed it. Outside, the younger doctor who had mocked Elara's tattoo sat alone in the hallway. The veteran nurse walked past and stopped. "Tough day?" He nodded quietly. "I judged someone without knowing anything about her." She sat beside him. "Happens more often than people admit." "I kept thinking that tattoo was just an old design." The nurse smiled gently. "Turns out it was a reminder." "A reminder of what?" She looked toward the operating room doors. "That some people carry stories they never tell." He stared at the floor. "I owe her an apology." "Then make sure it's sincere." Back in City, the surgery entered its final stage. The hardest decisions had been made. The team worked together without hesitation. Nobody cared about titles anymore. Ideas came from every direction. Rowan listened. Elara advised. The nurses responded immediately. For the first time that day, it truly felt like one team. Then another alarm suddenly sounded. Sharper than before. Every eye turned toward the monitor. The stable rhythm disappeared. The numbers dropped rapidly. The room froze for one brief second before everyone moved at once. Rowan looked directly at Alara. What are we missing? She stared at the monitor, then at Calder. Her expression became completely still. She had seen this pattern once before. Many years ago. On a battlefield she had spent her entire civilian life trying to forget. And she knew exactly what had to happen next. The answer came to Alara before anyone else in the room saw the pattern. She stepped beside Chief Rowan and spoke in a calm, steady voice. It's not the procedure. It's the pressure around the repair. We need to relieve it before we continue. Rowan looked at the monitor, then back at her. You've seen this before? She gave one small nod. Only once. He didn't ask where. He didn't ask when. He simply trusted her. Let's do it. The surgical team adjusted immediately. Every movement became deliberate and controlled. The room was silent except for the steady voices giving updates. Pressure changing. Heart rate responding. Hold it there. Several long seconds passed. Then the warning tone stopped. A steady rhythm returned to the monitor. No one celebrated. Not yet. Everyone stayed focused until Rowan carefully completed the final stage of the operation. At last he stepped back and looked around the room. I think we've got him. A quiet breath of relief spread across the team. One nurse smiled behind her mask. Another wiped tired eyes before checking the final readings. Rowan removed his gloves and looked directly at Alara. I couldn't have done that without you. She shook her head. You didn't do it alone. Ismail. Neither did you. It was the first conversation they had shared as equals. Outside the operating room, the waiting military crew stood the moment the doors opened. The senior officer searched Rowan's face before asking a single question. How is he? Rowan looked toward Alara first. Then he answered. He's stable. The words seemed to lift a weight from every person in the hallway. Several helicopter crew members quietly smiled. One closed his eyes for a moment. Another whispered, thank goodness. There were no loud cheers. Only grateful silence. The senior officer walked toward Alara. For the second time. It paused. You brought him home. She looked down for a moment. We all did. Ismail. You still say that? Because it's true. A few hours later, Calder slowly opened his eyes in the intensive care unit. The room was peaceful. Morning sunlight filtered through the window. The first person he recognized was Alara, quietly checking his chart. He smiled weakly. I made it. She returned the smile. You did. I knew you wouldn't let me lose this fight. She adjusted the blanket. You did the hard part. He looked at her wrist where the faded tattoo showed beneath her sleeve. You still wear it. I always will. It reminds you. She nodded gently. It reminds me of everyone who came back. He noticed the pause in her voice. And the ones who didn't. She didn't answer. She didn't have to. Later that afternoon, Chief Rowan asked the entire trauma department to gather in the conference room. Doctors, nurses, technicians, administrators, and support staff filled the room. The atmosphere felt very different from the day before. Nobody was joking. Nobody was whispering. Rowan stood at the front. I owe someone an apology. Every eye turned toward Alara. He faced her directly. When I first met you, I believed experience only came with titles. He paused. I was wrong. The room remained silent. I judged you before I understood your past, your skills, or your character. A took a slow breath. I'm sorry. The younger doctor who had mocked her tattoo stood next. So am me. Another physician quietly nodded. I am too. No one was forced to speak. They chose to. Lara looked around the room. I appreciate that. She smiled gently. But if you really want to honor yesterday. Everyone listened. Remember that every person wearing these scrubs has a story. She looked at the nurses. The doctors. The technicians. The cleaning staff standing near the doorway. Respect shouldn't depend on someone's job title or the things you know about them. The room became very still. Those simple words reached everyone. A few days later, the hospital director organized a small ceremony. Nothing extravagant. Used the staff gathered together after their shifts. The director stepped forward with a framed certificate. We would like to recognize Nurse Lara Vaz for extraordinary professionalism and outstanding service. I offered her the award. She accepted it politely. Then she surprised everyone. I'll keep this. She smiled. But only if every member of the surgical team signs the back. Several people laughed softly. Nobody saves a life alone. Pens were passed around the room. Doctors signed beside nurses. Technicians signed beside administrators. Housekeeping staff added their names too after being encouraged by everyone else. By the end, the back of the frame was filled with signatures. Exactly the way Lara wanted. That evening, the two Black Hawks prepared for departure. The helicopter crews lined up near the landing pad. Colder, still recovering but strong enough to stand with assistance, asked for one last moment before leaving. Lara walked outside. The wind gently lifted the edge of her sleeve. The faded tattoo became visible again. Colder looked at it and smiled. You know. I said quietly. People probably see faded ink. She looked down at it. They do. I see courage. She laughed softly. I see old memories. A extended his hand. Thank you. She shook it. You've already thanked me once. Not for this. A looked toward the hospital. You reminded a lot of people what quiet strength looks like. The helicopter crew saluted her. Not because they had been ordered to. Because they wanted to. She returned the gesture with a simple nod. Minutes later, the Black Hawks lifted into the evening sky. The sound slowly faded into the distance. The hospital returned to its usual rhythm. Ambulances arrived. Phones rang. Patients needed care. Inside the emergency department, Lara tied back her hair, adjusted her scrub sleeves, and picked up another patient chart. A frightened little girl looked up at her from a hospital bed. Are you my nurse? Lara smiled warmly. I am. The child reached for her hand without hesitation. As Lara gently squeezed it, the edge of the faded tattoo peeked out from beneath her sleeve once more. This time, no one laughed. Everyone who noticed it understood that some of the strongest heroes never ask to have their stories told. They simply keep showing up, one patient at a time.